Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system and take actions to make the system better for all of us. Today, the topic is called Medicare Disadvantage, Billions Stolen from the U.S. Government. First, let me tell you that in the description area below, I'll post a link to the Healthcare Advocacy Newsletter that is the text for today's video. All of the links that I mention will be in there, as well as the action for today. Okay, October 15th of 2023 was the start of the Medicare sign-up season. In honor of that, we're going to discuss how insurance companies become wealthy at the expense of taxpayers. Now, remember, Medicare Advantage is not Medicare. It is private insurance that Medicare subscribers, those eligible for Medicare, can choose instead of Medicare. Medicare, the government is the insurance company. Medicare Advantage, it's private companies. Okay, let's continue. There's an organization called Physicians for a National Health Plan, and I've put their links in our newsletter regularly, and you'll see it in today's newsletter. They've been researching the fraud in Medicare Advantage programs for quite a while, and they have a new report on the subject. What they found is that between 88 billion and 140 billion were actually overcharged to the U.S. government in 2022 alone, just that 1 year. I'll have a link to an overview article and a link to their report, as well as a link to the PNHP website. It's a good organization. Let's take a step backwards to see how we got here. The Balanced Budget Act of 1997 established a new Part C of Medicare. Then it was called Medicare Choice, MC, and it was effective January 1999. Now, in the early 2000s, it was relabeled Medicare Advantage. It was an interesting idea. The government, in an effort to buy down risk, would pay private insurance companies to assume that risk. It's not an uncommon thing in the insurance world. It's often called reinsurance. That payment that the government makes to these private insurance companies is a minimum $1,000 per month for every subscriber. If the insurance company thinks that that patient or that subscriber may be a little sicker than nominal, then that amount can be way higher per month. Now, keep in mind, this has nothing to do with the money that subscribers pay monthly to Medicare for Part B, nor any additional premium that they may pay for their Medicare Advantage policy. This is strictly from the government to the insurance companies. Well, part of the idea was that the government could save money this way by passing the risk over to insurance companies. However, research from the Medicare Payment Advisory Commission, it's called MedPAC, it's an independent agency that actually is chartered to provide advice to the government and Congress on Medicare, shows that the program has not yielded savings in the last 2 decades it's been established. It does, however, provide the most lucrative health insurance program ever for insurance companies. It is essentially a giant giveaway. Now, those Medicare Advantage plans may put a cap on subscribers' yearly maximum expenditures, but there is a huge price to pay in copays and deductibles. And we've written stories and I think had videos about how the top Medicare Advantage providers have been cheating the government. In fact, the Department of Justice has lawsuits against them for willful fraud. And I think I addressed this in the last week or so. And let me point out, whether they are for-profit or non-for-profit, not-for-profit, it doesn't matter. Fraud is involved. And the reason I say it's willful fraud is that the government very gently points out areas of overcharging. And if they find that the insurance company hasn't corrected it when it's been pointed out to them, That's willful fraud. Okay, well now back to the PNHP analysis. Here's how they cheat. There are 4 different ways. Researchers found that Medicare Advantage plans actively seek out healthier patients. Targeting their market toward a healthier demographic is a process called favorable selection and favorable deselection. The flat rates that the government pays to Medicare Advantage insurers is actually based on the costs that traditional Medicare participants have, and they tend to be far sicker. So it's higher cost to the government, and so they reimburse the Medicare Advantage plans more. Research shows that patients tend to switch to traditional Medicare as they get sicker because Medicare Advantage plans narrow the provider network and they have restrictions on care that can be provided. When that happens, it becomes difficult for patients to obtain a Medigap plan. This is just an aside. Medigap plans pick up much of the open-ended cost that Medicare has. Now, if you're not familiar with this, let me just take a brief aside and tell you Medicare is an 80-20 insurance plan. The government pays 80%, you pay 20%, and there's no cap on that 20%. That's what the Medigap insurance plans do. And they become harder to get the older and the sicker you are. Okay, now remember MedPAC? They found just this last June that favorable selection for a healthier Medicare Advantage population results in 11% lower costs for Medicare Advantage plans, even as the insurers get paid on the basis of the traditional higher needs, sicker Medicare population. I know, it sounds confusing, but guess what? The estimate of the amount of benefit to those private insurance companies is between $44 and $56 billion every year. Okay, upcoding. Now, that's a second way that they make money. We've discussed this one before. The insurance companies will list you as sicker than you are so they can increase their monthly payments. They love to say, you've got hypertension. Try and get it under control. But once they mark you with hypertension, more money to them. Wait, let's do a body mass calculation. If you're just at the borderline or a little bit higher, you must be obese. More money to the insurance company. They get way more than that $1,000 a month for way more people who don't really cost them more in the insurance business. Now there's a news organization online called The Lever, and the link is of course in the newsletter below. This past May, they examined this fraudulent practice of upcoding. They found it was worth an extra $20 billion to the insurance companies. Okay, now this part is going to be a little complicated. Quality benchmarks and county bonuses. Currently, this is the third way they make money that they shouldn't. Currently, Medicare provides bonuses to Medicare Advantage plans based on the locations they cover, supposedly to ensure equal geographic access to coverage. But MedPAC found in their 2023 report that these payments are not necessary for maintaining affordable supplemental coverage, and they fail to capture savings for the Medicare program. So it's essentially bonus giveaways to the insurance companies. Insurance companies falsely increase their quality ratings and payments. They increase the payments they get while frequently denying care to patients and increasing profits. The measures used to allow this in the way the government has it set up make it possible for the insurance companies to do this. Now, the PNHP report looked at this kind of behavior, and what they found is it's worth between $24 to $28 billion in a single year in overcharges to the government. Okay, this last one is called induced utilization. Now, I got to tell you, I'm going to take a brief aside from the text here, and let me tell you, there was a study done it was a real experiment with real insurance that was done in the mid-90s by the Rand Corporation in Santa Monica, California. And what they wanted to know was, If we charge copays and have deductibles, does it affect people using insurance? Because in some countries it does, and in some countries it doesn't. They found it dramatically affects the way people use insurance. The smallest of increases in copay in the United States resulted in dramatic underusage of the insurance. So what happens is, if I increase the amount you have to pay when you go to the doctor, way more people will not go to the doctor. And what happens? The insurance companies get to keep the money. Okay, hold that thought. So induced utilization is the idea that people with supplemental coverage are likely to use more health care because their insurance pays for more of the cost. Remember that 20% Medicare open-ended business. And that would remove some of the financial barriers to accessing health services. People with Medicare Advantage plans have a yearly maximum cap, whereas traditional Medicare does not, unless you buy that gap insurance we talked about. The value, what is that worth? About $108 a month per subscriber, or $36 billion in advantage that the Medicare Advantage insurance companies get. They receive this directly from monthly payments that people pay to Medicare. It is just so not fair. Okay, I know this was long and somewhat complicated, so let's summarize it. Profiteers want to make our healthcare system more unequal and ineffective than it is, and they make money doing it. If we want to one day have improved Medicare for all, we can't let corporate insurers have their way. We need to stop them. So here's today's action. I am sure that our Congress people and our senators are not as well versed about this as you are now. So you should contact them. If you go to my newsletter, you'll find in the resource section, you can get their phone number or their email, or on your cell phone, if you text to 50409, sign, S-I-G-N, PDRWJD, PDRWJD. This is the email you'll send. I'm your constituent, and I just learned how private insurance companies are gaming the Medicare Advantage system and overbilling the U.S. government. It is not Medicare, it is private insurance, and we pay them over $1,000 a month to provide insurance for seniors. They deny prior authorizations, they provide less health care than traditional Medicare, and they are overbilling on the order of $140 billion in 2022 alone. There will be a link in the email to the PNHP report so that the Congress people can read it, and we should make sure to tell them to read it. We need you, your congressperson, to fix this system by enacting the improved Medicare for All system, H.R. 3421. No private insurance, cradle-to-grave coverage, no copays or deductibles, so people will go to the doctor when they have to. You can fix this, and I want you to do it, and that's what we've got to tell them. Okay, like, share, subscribe, read the newsletter, subscribe to the daily newsletter. Thank you, and take the action. Have a good evening.